Hello, everyone. Thank you so much for taking time out of your Friday afternoon today to join us for the virtual showcase launch of the SpeechFirst Minimum Viable product, an application set to positively transform the future delivery of speech therapy. I am Agogo Akwana and the product owner for this project. The team and I are excited to share with you what we've been able to develop in just a short space of 10 weeks. We welcome any questions, so please do share this on the chat and we will address as part of our Q&A at the end. And with no further ado, I'll hand over to Holly, the original founder for SpeechFirst and our business case lead, to talk to the background and our why for the solution.
Thanks, Agogo. Hi, everyone. Thank you so much for joining. It's really great to have so many people join us for this event. So for those of you wondering how and why this concept came about, well, Capgemini believe that we all have a role to play in digital inclusion. And we firmly believe that we can really use our skills across the whole business to help society address the impact of the digital revolution. That belief really was at the heart of the Global Tech for Positive Futures Challenge, which launched in January of last year, and encouraged colleagues from across the group to submit a potential technology solution to a societal issue. Myself, along with 6 other colleagues, submitted the idea of a speech therapy app that uses AI to give feedback to users, and was selected as one of the winning initiatives that Capgemini would support to bring this solution to life. The idea was born out of my own family's experience. My dad, pictured here, had a stroke at the age of 43. He was fit and healthy with no underlying health conditions, and suddenly found himself in a situation where he was unable to communicate. Whilst there's some short care provided by the NHS, it was really left to him and the family to support his own rehabilitation. So we're not saying that this is the answer to all of the problems, but what we really do believe is that SpeechFirst can support the intensity and frequency of therapy, reducing or staggering the need for face-to-face sessions, and providing a way for therapists to track and monitor their patients over time to see how they are progressing against their goals. We really believe that this could be quite revolutionary to speech and language therapy and can be a real disruptor to the existing apps on the market, which are relatively archaic or difficult to use. Next slide, please. So we know from our research that around 100,000 people in the UK have strokes every single year, and 1 in 3 of them will develop speech and language impairments. We really wanted to use the technology expertise of Capgemini to improve the lives of these people and people like my dad, so that he doesn't have to practice his words by reading from a children's dictionary even 14 years after his stroke. We know that technology has massively moved on in that time, and so can speech and language therapy. Next slide, please. So we know that the solutions in the market today do not meet the need of this underserved population. This is due to healthcare resourcing constraints. The NHS can only provide, on average, around 6 weeks of therapy, which just isn't enough. And this came to light even more so during the height of the pandemic, when therapy services were reduced down to just 2 weeks, which is a 300% reduction. Sessions are also often inaccessible. They typically require therapists to travel, meaning that less time can be spent with the service user. And finally, often the people requiring this type of therapy will potentially be out of work or have financial burden. And private sessions outside of the NHS can cost anything from around £70 to £100, which is unaffordable for many. Sorry. Next slide, please. So we know and have explored the impact that this can have on stroke survivors, but our partnership with UCL has also revealed that actually we could be supporting even more user groups. So people living with a wide range of neuro-disabilities, including Parkinson's, brain injuries, or other degenerative neurological disorders, could also potentially benefit from our solution as well. Next slide, please. So we've been fortunate enough to have the support and guidance from Professor Rosemary Varley at UCL, who recognises the limitations in the healthcare system and the burning need for technology to support this problem. As Rosemary quite neatly outlines here, these high quality apps can not only increase the frequency of therapy, but they also give people with a neurodisability the autonomy to be independent, which is something that is often lost for many after these illnesses. Next slide, please. So our mission with SpeechFirst is then simply to make speech and language therapy affordable and accessible. It is a pioneering AI-powered application for adults living with a neuro-disability that delivers speech and language therapy practice through therapist-recommended exercises, all in the comfort of their own home. I'll now pass you over to our user experience designer, Nat, who will be able to take you through what we've achieved in the last 10 weeks.
Great, thanks, Holly. So as Holly has mentioned, we have a really clear mission and vision for SpeechFirst. However, we had to turn that into a reality in just 10 weeks. So we decided to build a minimal viable product, or MVP for short. An MVP is a product with enough features to test with a group of users and validate the product idea, but most importantly, get feedback quickly. We wanted to ensure that our idea was desirable, viable, and feasible. So we aimed to explore 3 key questions. The first, would patients and speech and language therapists actually use this app? Is it something that they want and need? 2, what is the commercial model for SpeechFirst? How will it enter the market? And lastly, can the technology we have chosen actually enhance the patient and therapist experience? Next slide, please. So within just 10 weeks, we designed, built, and tested the core functionality of SpeechFirst. At its core, SpeechFirst is a virtual speech and language therapy platform designed and built with 3 key principles in mind: simple, modern, and inclusive. The platform provides 2 unique experiences. The first is a web-based portal for the speech and language therapist, and the second is a user app that can be accessed on both iPad and Android tablet. We recognized from a really early stage in our process that there are a number of communication difficulties for those living with a neurodisability. We uncovered that there are several apps on the market that address aphasia, but there are minimal support for those living with dysarthria. So that is why we focused our MVP specifically on dysarthria. Dysarthria is a weakness of the muscles you use to speak, affecting your tongue, lips, mouth, and breathing, which can in turn affect articulation. So we designed 5 core exercises collaboratively with speech and language therapists that focus specifically on articulation, as this was really a common problem for those living with dysarthria. As you can see on the slide, there are 5 core exercises, including imprecise consonant sounds, simple words, and phrases. So SpeechFirst has really been built to be robust and adaptable, ensuring that we have the building blocks, not only to build upon these current core exercises, but to add more personalized features in the future. Next slide, please. So how does it work? Well, the journey begins during an appointment between the speech and language therapist and a patient. The SLT adds the patient to the SpeechFirst platform and assigns exercises based on the patient's therapy level. Then it's over to the patient to do their assigned exercises in a time and place that suits them. The exercises are designed to be simple, clear, and easy to use. Once the patient's completed their exercise, they will receive feedback in real time, including an AI score, a highlights reel, and tips for areas of improvement. That completed exercise has now also been sent to the SLT, who will be given the recording of the exercise and a transcript of the scores. Not only the AI score, but the speech and language therapist will also see pitch, volume, and speech speed. So the SLT themselves can provide a final score on the exercise based on their expertise, but they can then also update the therapy plan and assign new and relevant exercises to the patient. Next slide, please. So I lastly just wanted to touch upon the user-centric approach when designing SpeechFirst. We had countless number of interviews and focus groups with both SLTs and stroke survivors over the past 10 weeks. Their feedback has really shaped the design to date, and I just wanted to bring to life 3 key insights that we uncovered. The first is the use of simple language. We recognise that people living with a neurodisability may also be suffering from multiple speech and language disorders, such as aphasia. So we wanted to keep the use of language simple, but also positive and uplifting in order to encourage the user to keep going with their exercise, especially as they would be doing the exercise alone. We learned that there's a real need for repetition and reminders to stimulate the best results. For example, sit in your best position, take a deep breath. These are all tips that will help the user perform to the best of their ability. And lastly, the importance of feedback and self-assessment is critical for the SLT to understand how the patient is feeling, especially because they're not in the room with them. Often there are some outside contributing factors as to why the patient may not be feeling their best. So it's really important for us to capture this through the user interface. So through our research over the past 10 weeks, I can confidently say that this is an app that people actually want to use and are needing in their lives. So I'm now going to hand over back to Agogo, our product owner, who will talk you through some of the types of technology we use to create the SpeechFirst platform.
Nice, thank you, Nat. So throughout development and iteration of the SpeechFirst AI models, our data scientists worked hard to ensure that ethics was a primary consideration. We ensured inclusivity by training our data via a collection of sound data sets with over 3,000 plus sounds analyzed, whilst also ensuring robustness with a 99.5% accuracy on the evaluation of speech sounds. In building this MVP, the team were empowered by the latest technology, and we're also lucky to be able to leverage best-in-class tooling for AI development, as well as scalable, secure infrastructure for hosting our solution, thanks to our technology partner, Amazon Web Services. Next slide, please. So, to deliver a solution of such intricacy, this requires a multidisciplinary team of experience. This ranges from our very talented team of user researchers, designer, engineers, data scientists, and very importantly, key individuals working on ensuring that there was a commercial route to scale our solution from a business and partnerships perspective. Next slide, please. The SpeechFirst solution was grounded in the guidance from our sponsors within Capgemini, as well as from academic partners from UCL and literature review support from a speech and language therapy students at the University of Reading, and additionally, our technology partner, AWS. We would also like to express our thank you for support given by the Health Navigator, Stroke Association, Cambridge Consultants, and Different Strokes. Next slide, please. So, just to reiterate the need for SpeechFirst, there is a clear demand for an AI-driven application, which we can see based on the competitor analysis we conducted on apps within the speech therapy landscape. A high number of speech therapy apps are geared towards aphasia, and in the words of an SLT we spoke to, there is huge potential for SpeechFirst if we work further to explore this area with a similar mindset of most resources in the market, which are mainly focused on aphasia. Additionally, our vision for SpeechFirst is that it's of minimal cost to the user, as most apps in the market are extortionate in pricing. Now I'll just hand over to our senior full stack engineer, Dan, for a live demonstration of the app in action.
Great, thanks, Gogo. So, hey everyone, I'm Dan. As Gogo introduced, I'm a senior full stack engineer and tech lead at Capgemini, and I've been working with our data scientists on our SpeechFirst project to make this a reality. So I'm going to show you what SpeechFirst is like as both a kind of patient and a therapist. So we'll start off, you should be able to see the patient's mobile app running on my iPad. So I'm on my patient's homepage. I'm greeted. I can see that I have 2 exercises to complete today, the first being a consonants exercise. So I'm going to go ahead and make a start on that. So the SpeechFirst app starts by getting a kind of sense check on how I'm feeling today to kind of give me a bit of a baseline. So playback day, so I'm feeling extremely happy. And great, now it's going to coach me through getting set up to do my best throughout this exercise. So making sure that I'm in a good seating position, that I'm kind of sat upright, that I've taken a deep breath and prepared myself for the exercise, and then that the webcam can see me. Great, so now it's going to count me down and I can start the exercise. So throughout each exercise, we have videos provided by speech therapists, and the app will kind of coach you through saying at the correct time. So apart. If I'm not happy with that for any reason, I can go ahead and repeat that individual segment of the exercise, or I can continue on to complete. So again, I'll say it with the speech therapist first. So our bar, and then say it alone. Our bar. Great. So again, I've got the option to repeat, but I was reasonably happy with that, so I'll just go ahead and click next. So at this point, I'm able to kind of self-assess how I felt that I did during that exercise. This is again just another data point that we can give to the therapist later on when they review my submission to kind of sense check how the patient's feeling about their performance. So I think I did okay, but not brilliant, so I'll give myself kind of 6 out of 10. So at this point, our data science platform is processing all of the recordings of the exercise that I did against the models that our team built. And it's going to score it in a number of different ways and come up with an overall AI score for my performance. So I scored 89%, so pretty good. And on the right-hand side, it gives me a little highlight reel playing back my best performances throughout that exercise. At this point, I've also got the option to save this exercise if I felt that I'd like to come back to it later and maybe practice it a bit more. And I can go ahead and click next to gain additional feedback into my performance. So our data science models have identified each sound and tried to score each one individually so that I know which ones I maybe need to practice a bit more, which ones are maybe kind of getting confused with other sounds. And it can give me that guidance straight away after I finish the exercise. So great, at this point, as a patient, I'm done. I can go ahead and move on to my next exercise, and my therapist can go ahead and review my progress. So now we're going to switch over to the therapist's app, which is running on my iPad. So great, I'm on the My Patients tab of the therapist app, and I can see the list of my patients along with a number of exercises that they've completed this week, which ones they haven't and kind of still need to do. And if they need maybe a bit of support or if they're kind of performing at the level that we'd set as a target. So I'm going to go ahead and click onto myself to see my submissions. So at this point, it will load up my profile along with my overall performance and then some detailed charts to show my performance over time in the various different metrics of the AI score, my self-assessment, and my reviewed score. And you can go ahead and kind of review those by the month or by just this week. At the bottom, you can see the exercise overview. So this is where you can see all of the submissions from the individual. So we'll go ahead and see the one that I just did. So here, scored 91%, great. And I can go and action that as a therapist. So at this point, I'm given a detailed breakdown of the submission from the patient. So I can see the performance by individual sound, and I can also play back the recorded audio and video so that I can take my own judgment and review this score myself. We're also given some overall statistics from our data science models around kind of pitch range and volume throughout the exercise and speed for the exercises for which that's appropriate. In addition, our model will also identify where there's areas of confusion. So if one of the sounds sounds more like another sound, we'll flag that here as maybe something that needs to be practiced. So I can make any additional notes that I want, or just go straight ahead and review the score. So I'm going to maybe reduce that score a little bit and save that. And at that point, I'm done as a therapist, and I've managed to review that exercise and amend the score to what I think would be correct for that patient. So finally, we have a video to show you, which I will play now.
There are 2.5 million people in the UK that have difficulty speaking.
There's a lot of discussion about the acute stroke and the post-acute stroke care, but what really impacts the patient is that rehabilitation and how long we can keep it going. We've got a limited number of therapists, and you look at how much more impact they can have.
And that's because there's only 17,000 registered speech and language therapists to meet this need. That's one speech and language therapist for every 147 people in need. Capgemini wants to support neuro-disability conditions through advancing the way speech and language therapy is delivered.
To stimulate a damaged neural network to reorganize, high-intensity practice is essential.
Introducing SpeechFirst, a leading AI-powered app for speech and language therapy to be used to support adults with speech impairments alongside their speech and language therapists.
The development of high-quality apps and other software allows people with neurodisability to work independently and to achieve the necessary dose of therapy to stimulate relearning.
The app enables the adults to practice their speech therapy through therapist-recommended exercises in the comfort of their own home.
I do it every day.
Digital technology gives us this opportunity, as well as offering the patient more control and reducing health inequalities.
It provides real-time feedback, whilst giving the user the power to learn in a way that suits them and their personal needs.
Yeah, good.
Good.
Yeah.
SpeechFirst, powered by Capgemini.
Cool. Thanks for that, Dan. So I'd imagine the question on everyone's mind is, what is the future of SpeechFirst? Well, the first key next step for us is now working on securing additional funding for the next release of SpeechFirst, which will focus more on the personalization aspect. This was insights repeatedly heard from our interviews with SLTs, and to enable sustainability of the video exercises, we also plan to ensure that the SLT has the ability to record these exercises for the patient. And of course, a very crucial step within this phase will be testing and validation to ensure our application is reliable during the case series, which we're very excited to confirm will be conducted within the UCL clinic. This will essentially put SpeechFirst in the hands of real people living with a neurodisability and SLTs, and we're very grateful for the support from the UCL clinic. Thereafter, once SpeechFirst's efficacy is proven, the possibilities for the application is endless. Currently, our understanding is that we're a Class 1 medical device. However, as the features evolve, this may mean we advance to a Class 2 medical device software. We're currently compliant from a documentation and product realization perspective, and we hope to work with a partner to ensure that we continue to remain compliant in quality management. There are also various opportunities to implement further machine learning with exercise recommendations based on patients' progress, as well as multi-language support to an addition of SpeechFirst Plus, which we heard from SLTs would be amazing for patients outside of their therapy sessions. So SpeechFirst Plus would be a non-therapist-led version of SpeechFirst, which was something we heard time and time again from SLTs. Thank you. And I believe now we are able to open the floor for questions.
Hi, Gogo. Yeah. We've got a couple of questions come through on the question feature. First one is for Mika, our data scientist. How does the AI behind SpeechFirst assess consonant clarity?
Yeah, that's a very good question. The way we approached that problem is we started by crowdsourcing many recordings of people that identify as having a healthy manner of speech. And this gave us a baseline for how people that feel they have clear speech pronounce different consonants. We then adapted some research coming out of Google for detecting, basically speech to text, the kind of thing you might see in your Google Home or your Android phone, to predict what these people were trying to say when making the sounds a pa, a ba, a ta, and having a model that could very, very accurately predict what sound was being made. We could then use that model to predict what the user of the app was trying to say. If the model was able to very confidently predict that the speaker was trying to say the consonant they were tasked with saying, that results in a very high score. If the model believes that they were saying a different consonant, then we treat that as consonant confusion. And if the model was not certain that a consonant was pronounced at all, we treated that as a low consonant clarity score. This has been calibrated within the team by going through some sample recordings and verifying that the AI score aligned with our intuition. But we see ways in which we could improve the fairness and robustness of this process once we have some more live data.
Thank you, Misha. Another question we've had is possibly for Holly. Have we got any other use cases for SpeechFirst in the future lined up?
Yeah, that's a good question. I think we kind of mentioned in when we were chatting through some of the user research that we think this could probably be scaled to other speech impairments. But I think there's also a use case potentially to use this with children in schools. Obviously, we've mentioned around the resourcing constraints of speech and language therapists, and that's not really something that's provided for children in schools, something that teachers have to do. So potentially there could be the opportunity to explore that. And I think also we mentioned around scaling to other languages as well. And I think with the technology we've used, that would be reasonably easy to do as well.
Thanks, Holly. This one is probably for the product owner at GoGo. What was your favorite and most challenging part of the delivery?
Yeah, so I'd have to say my favorite part was definitely when we received confirmation that we were essentially going to be looking to conduct a case series, so a clinical study with the UCL clinic. So that's very exciting because essentially that puts SpeechFirst in the hands of real patients and SLTs. From a challenging perspective, that's actually twofold for me. The first one would have to be around the user research. So typically in the AIE, so the Applied Innovation Exchange where I work, we're very empathy driven, which typically means when we have user research would actually go out to speak to the people the end users who would benefit from our solution. And as you can imagine, within this project, it was a bit more trickier. So having access to people living with a neuro-disability and SLTs was a bit of a challenge. But luckily, we were able to still get access to these two-stroke survivors just to get their perspectives on the designs. And then the second challenge would have to be the regulatory part. So having to navigate health tech is quite a minefield. And I know Holly can probably talk to that pain point in a bit more detail as well.
Yeah, definitely echo that was a challenge. I think it's just so complicated to understand where you sit depending on the features that you have. And also, not just that, but, like none of us are regulatory experts, but it seems that the regulation has kind of been built, well, not been built for technology basically, and for this kind of technology, the regulation needs to catch up really with how technology is moving on. So yeah, that's been a massive challenge. But I'll also just add that my favorite part has definitely been also testing it with my dad and really taking this through from like an idea right through to an end product, and being able to see him using it has been like just amazing really.
Thanks, Holly, that's really nice. Another question we've had in along similar lines, if you would go back to the start of the project, what advice would you have given yourself? Probably GoGo if you want to take that one.
From my perspective, it would be to be more familiar with the regulation within healthcare. Yeah, definitely that. More time spent on just understanding the regulatory route, because yeah, it does take lots of work, especially if you're not from that part of the field. So that would be mine. Then if you had something different, Holly.
No, 100% agree with that.
Thanks both. Another one for our data scientist. Does the app understand different accents, or is more data required in the future?
More data is always good, so I do welcome more data. The app so far has been developed based on that crowdsourced data set of consonant sounds. We built a data collection app and shared it widely within Capgemini and our LinkedIn network. And from that, we have had access from all across the UK and from several other countries. So we do think the app is fairly robust to accents. For longer words and phrases, we are leveraging AWS Transcribe, and we are deriving the score from the confidence that tool uses, and we believe that tool is quite robust to different accents. There's always room for improvement, and we look forward to extending that in the next iteration.
Thank you, Misha. Probably one for Dan, the full stack developer here. Do you have plans in the future to release this app on iOS, or is it available on iOS or Android in particular to make it more accessible to a wider audience?
Yeah, great question. So accessibility and making sure that everybody who needs this can get it is one of the kind of core design principles of SpeechFirst. So we've built it to be available cross-platform on both iOS and Android from now. So the demo that ran today was on an iPad. It's also being used on various Android tablets. So yeah, we're very keen to support as many people as we possibly can.
Thank you, Dan. Another one for Holly and Agogo, I imagine. Is there a plan to be moving into treating other impairments along the lines of aphasia, thinking skills, or movement?
So from my perspective, there's definitely opportunities for this, but we'll definitely see this as a partner-driven view and roadmap from my perspective. So yeah, definitely an opportunity for this, but with a partner supporting us on the journey.
Yeah, I would agree. I think it's a long-term goal. We kind of want to start small, make sure what we're developing to start with really works, which we hope to be able to do in the UCL clinical study. But yeah, fully appreciative that people don't have often standalone speech impairments. It's kind of accompanied by various other impairments that we mentioned, like aphasia, and often even the physical rehabilitation as well. So yeah, I'd definitely say it's like a big pipe dream to get something that's all encompassing.
Thanks, both. Another one for around the AI data science. Misha, how easy do you envision it to be to build the next set of features from a data science and AI perspective?
I'm not happy giving time estimates on the fly. But in terms of our prioritized additional features, which is the support for customization, so letting our patient or SLT decide what phrases and what words are meaningful to the patient, and therefore the words they want to practice, that should be a reasonable amount of work. We believe we should be able to incorporate that in time for the clinical trial. Other activities such as multiple language support, I'd have to run that with the team before committing to something.
Very understandable, Misha. A question we've got. When do you see this being ready to roll out to patients? And how much will it cost them to access? It's probably one for Agogo, if you'd like to take that one.
Yeah. So from a rollout perspective, we'd have to very much first be compliant. So as I mentioned within the next step slides, we're looking to ensure, in conjunction, of course, with a partner, that we are able to establish what classification of device we would be. And as soon as we've been able to go through the regulatory route, then potentially this would be able to be rolled out to patients as well as also proving the efficacy as well within the case rates with UCL Clinic. That will also be very key to a rollout. And was there a second part of the question?
It was around cost. So how much would it cost for a user to access?
So in my mind, I think Holly would agree. It would be free. It would be something that potentially an NHS trust could potentially take forward. So yeah, that would be the utopia for me. But obviously, if there was a cost associated with this, our vision for SpeechFirst is that it's minimal cost to the user.
If I could add to that, Agogo, the way the technical side of this has been developed, the AI, the video recording, the app development, this incurs a minimal running cost, but of course the support of a speech and language therapist is essential to the solution as it's currently designed. So we definitely see this as a partnership with a health organization such as the NHS.
Thanks. We have one for our user research. Nat, if you're available, can you describe the process you took to conduct user research with the speech and language therapists?
Yeah, sure. Thanks, Alex, and apologies that my webcam isn't working. So the process is very kind of typical, one that we use within the AIE, and it's to conduct as much research as possible. And we were really fortunate to gain a lot of time from speech and language therapists from all over the country, and the way we gained access to them actually happened quite organically, and a lot of it actually came through social media, so just posting via LinkedIn, via Twitter as well. We were really amazed to see how many people were willing to volunteer their time. Also through UCL, we had a number of professors also voluntarily giving their time, and we really needed to access their expertise. So what we did was conduct both individual interviews with speech and language therapists, but we also conducted multiple focus groups. So these were hour-long sessions where we would run them through screens that we had designed. We assessed the language, the illustrations as well, and just gained as much feedback as we possibly could, and then iterated upon those designs and again tested them again. So we were really fortunate enough to speak to many speech and language therapists, and this wouldn't be possible without them.
Thank you, Nat. We have one around the app functionality. So someone who has downloaded the app last night but received a couple of warning boxes. One for our full stack developer, Dan. Would you consider using a more secure process to download?
Oh, yeah, sure. So just a brief kind of thank you to everybody that's downloading it and trying it out at the moment. At the moment, we're in like a pre-release kind of beta phase. So the distribution is kind of restricted and a touch more complex. Now that we're in a position where kind of everything's a bit more stable and kind of getting, and it can start to get into the hands of patients, it will just be available on app stores like every other app. So it's just kind of quirk of getting early access to people so we can make sure we've got that feedback and build that into making the best possible experience.
Thank you, Dan. We have a good question in the chat here. Is there anything we, businesses, citizens, organisations can do to help support this initiative going forward? Probably one for you, Agogo or Holly.
Yeah, from my perspective, as Dan said, we're currently in pre-release phase, so we're very much open to continuous testing of the application. So we definitely welcome if you have contacts with people living with a neurodisability to essentially help us test our apps. We also very much welcome support from SLTs as well, to again continually like get their advice around testing. And then from a partnership perspective, we also welcome charities as well as organizations who would like to work with us in partnering going forwards. And I believe as a follow-up email to this session, there's actually a form which you can fill in if you're interested in partnering with us. So we're definitely keen to work with you to see how we can advance SpeechFirst going further. Holly, I'm sure you have potentially something else.
I would just say from like a citizen's perspective, it would be great if people are interested or like what they've heard today, then like please feel free to share on your social media. We'll be sharing the video that we played as well, which you can share. So just help us create a bit of hype and buzz about this, and hopefully we'll be able to take it even further.
Thanks both, really good answers. Thank you all who attended for the questions. I'll pass you back to Agogo and Holly for a little wrap up.
Yeah, thank you so much. Thanks everyone for your time this afternoon. Thanks for joining us. Hopefully you're just as excited as us for the future of SpeechFirst. We're very keen to hear from you. So if you'd like to reach out directly to myself or Holly, we're happy to discuss further. And as I mentioned, there's going to be a form as a follow-up to this session, just to, if you're interested in partnering with us, we'd also love to hear from you. So thank you so much for your time. And thank you as well to our partners and sponsors as well. Very grateful. Holly?
Thank you, everyone. Yeah, thank you. Thanks for joining.
Thank you, everyone.